Good afternoon and welcome to another virtual town hall. I'm Sarah Loudon from Total Health Conferencing, and today we will be talking about leukemia and COVID-19. I'm joined by 3 advocacy organizations, 2 medical experts in the field, a physician representative from Pfizer, who's also the vice president of the global medical franchise for hematology, and a patient. And so as you have come to know, our format always includes a conversation with each one of the groups, and then a wrap up that includes questions and answers from the audience. So we invite you to get engaged, to relax, to enjoy this conversation. And as you have questions throughout the sessions, please feel free to both add those in the Facebook chat as well as if you're joining us on the Zoom webinar, to add them in the discussion or chat session on your Zoom app. So I want to thank everyone who's here. I want to quickly go through who we'll be joined with today, and then we'll transition right away to get started. So we have with us the Leukemia Lymphoma Society, the National Bone Marrow Transplant Link, Imerman Angels, and then 2 physicians, Dr. Michael Mauro from Memorial Sloan Kettering and Dr. Ravi Vij from Wash U in St. Louis. And then again, we'll be joined by a global representative from Pfizer, and then finish off with a patient, Meredith, to tie things all together for us so that we really see the impact and importance of advocacy and credible medical information during this time. So I'm going to ask my team to bring up Meredith, Peggy, and Jackie. And while we're doing that, again, feel free to start thinking about questions you might want to ask various members of our panel so that we can keep moving this conversation forward to include things that matter to you. So thank you, ladies, for being with us today. This has become such an important series, and one of probably the most incredible things that I've discovered, having come from purely a medical education from the clinical side background, is that adding the patient advocate voice to the things that we do enhance it in ways really that I had never expected. Because not only are you getting the voice of people going through various disease and the stages of that disease, but you also get to marry that with things of impact that go well beyond treatment. So I'm really excited to have each one of you here and to dive deeper into the things that you're doing as an organization. So I'm just going to start with asking each one of you to introduce yourself, your role at where you work, and then maybe just a minute or 2 about your organization so that we can give the audience context of how we'll dive deeper. So Meredith Barnhart, I'm going to start with you.
Thanks. Hi, my name is Meredith Barnhart. I'm the director of our Information Resource Center at the Leukemia and Lymphoma Society. So we're the call center. My staff and I are actually the ones that are talking to patients and their caregivers on a daily basis about treatment options, support resources, financial information. So thank you so much for allowing the Leukemia and Lymphoma Society to join today. I love talking about LLS and really our background. So that you know a little bit about the Leukemia and Lymphoma Society, we are called the Leukemia and Lymphoma Society, or we refer to ourselves as LLS. And we were founded more than 70 years ago. And we were actually founded by a family for families. And since this, we have worked tirelessly to find cures and help blood cancer patients find the care and the access to treatment that they need. So our mission is to cure leukemia, lymphoma, Hodgkin's disease, myeloma, and improve the quality of life of patients and their families. Since our inception in 1949, LLS has invested nearly $1.3 billion in cutting-edge research that has really led to breakthroughs in the blood cancer space. We are also the leading source of free blood cancer information, education, and support. And this is shared with patients, survivors, families, and healthcare providers. And we also have an advocacy and Office of Public Policy component, and through their nationwide grassroots effort of more than 50,000 active online volunteers, we advocate for patients to protect their access to care, to break down barriers to care. And so all of these three groups really work together so that we are a patients first organization and really working to support blood cancer patients and their families. Our work has helped millions of blood cancer patients, and since the 1960s, survival rates have increased, and we're really excited to see that work continue. And thanks to the physicians that we have online who have made contribute, the Leukemia and Lymphoma Society will stand there and help to support and move blood cancer research forward and the care for patients.
Thank you, Meredith. I have so many questions for you, and so I hope the time doesn't go by too fast so I get to ask all of them. Peggy Burkhardt, I'm going to go with you next.
Hello, I'm Peggy Burkhardt. I'm the Executive Director of the National Bone Marrow Transplant Link. I have been with the Link for 5 years now. I took over for a woman who started, an amazing woman who saw a need in 1992. Myra Jacobs started the Link to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow stem cell transplant from diagnosis through survivorship. We provide vital information through resource books, lunch and learn programs, webinars, now podcasts, and we also have a licensed staff social worker, Jennifer Gillette, who is also available for one-on-one opportunities for patients that need some guidance and emotional support, as well as we have a peer mentor program that Jen leads so she can buddy up, if you will, someone that is in need. It is my pleasure to be with you today, and I'm proud to say that we partner with both LLS and Imerman Angels, and later when you meet Meredith, also the Meredith Crowden Foundation, and I'm just so happy to be able to help more patients in this format and be with all of you today.
Thank you, Peggy. Jackie Harrigot, maybe you can give us a little bit about you, the organization, and your role there.
Sure. Thank you too, for having us all on these webinars, even though we're stuck in the house, are definitely paying off. We're talking to more patients and hearing how they're learning about our organization, and the webinars are helping get the awareness out. That's one of our biggest problems at Imerman Angels, is not enough people know about us. So I came to the organization in 2012. I am the Director of Programs and Outreach, and my interest was because I heard the mission, which is pure and simple. We just want to provide understanding and comfort to those that are on that journey, whether a cancer fighter, a survivor, a caregiver, or even what we call the previvors. We're connecting them to somebody who's already been there, somebody that understands what you're going through. They've been in your shoes, and they're there to provide you that emotional support. And so I had lost my mom, my aunt, my grandmother all to cancer prior to knowing about Imerman Angels. So I knew what it felt like to be alone, and I knew what it felt like to have that experience and not really know what to do with it. And so when I heard the mission, it was easy. I said, oh my goodness, I got to get involved, and I want to make sure that nobody feels that loneliness and isolation, and so I want to do something about it. So I joined, and here I am, and we are in over 100 countries. We have over 11,000 volunteer mentor angels that are helping provide the support. They want to give back, and they just want to talk to someone else to shed some light and let them know that they don't have to go through this alone. And that's our pure mission. And we work with these guys too, and it's so nice to be able to collaborate on webinars like this. So thank you so much.
Well, thank you to all three of you. There's such a common thread, whether it be in leukemia or, we've done these for other cancers, breast, lung, GI. the common thread I think that runs through advocacy is that need for connection, that need to let people know that there are resources available, but more than the resources available, there are people powering those resources that all are coming from these various experiences, you know, some that have been touched personally as a survivor or someone in active treatment, or some like you, Jackie, who have had a great deal of loss, all stemming from cancer, where it really just powers you, moves you, impassions you to do something about it, and to let other people know, you know, that they aren't alone. And that's really also the goal of these virtual town halls. You know, all of us have an audience, and I think COVID-19 gave us an opportunity to start to look at the audience, even though we always felt that they were segmented, to look at the audience in ways that we could connect them. So to be able to be a company that focuses on medical education in terms of educating physicians on the latest in cancer treatment, when COVID-19 hit, we started thinking physicians aren't seeing patients. So patients aren't getting information, and then patients aren't being able to give their doctors the same level or quality of information as before. So if we could create a platform that allowed those two audiences to talk to each other, that we thought that that would be really powerful. And, you know, as I mentioned in our prep call for this, we've reached thousands and thousands of people, more than we ever would have if we were just reaching our initial, you know, community and physicians. So I do commend you and your organizations for what you do and the ways you do it. And for our listeners, you can tell these are very different organizations in their size, in their structure, in their resources, in their abilities. But one thing too to note is, you know, all three of them, but both Peggy and Jackie really highlighted that they work together on things like this and other things that really matter ultimately to the patient going through these experiences. So, you know, along that vein, here we are, you know, it's status quo, life as usual. We're all looking forward to a great 2020. And then everything changes. You know, it felt like overnight, everything changed. That one day it was, there's this virus happening somewhere over there. You know, let's keep an eye on it. It's 5 minutes of the news cycle. And then it was like, oh, there's a couple of cases in California, and then here's a couple of cases in New York. And then it was just utter lockdown. So that affected organizations like all of ours in such significant ways. And I wanted to start with you, Meredith. What was the initial and enduring action and reaction by the Leukemia Lymphoma Society to maintain the way you were encouraging and empowering your patients, but also to innovate so that you reached patients in a different way?
Yeah, so that's a great question. And I mean, I think for all of us, it was really sitting there and hearing about these COVID cases and not really understanding what that would mean for the United States, let alone for our blood cancer patients. And then all of a sudden it was here, and the Leukemia and Lymphoma Society, our national office is located in Rye Brook, New York. So we were really in the middle of that pandemic and really starting, you know, New Rochelle being not very far and one of the epicenters. So LLS really, you know, we really wanted to take that step forward. You know, we're so fortunate to have really amazing leadership in place, and they have been tracking it from early on and starting to set us up so that we could succeed and so that we can ensure that blood cancer patients and their loved ones really have the information that we need. So we really, you know, like many of the nonprofits, we really took to this global pandemic and put in place more resources and sources of support. So one of those resources and support is our Information Resource Center. We are master level social workers, health educators, nurses, and we are there to help patients and to really help them understand what it means to be a blood cancer patient. We also took the opportunity to kind of broaden our scope and our depth of information, and really to build on what it means to be a blood cancer patient in light of COVID. We found that when patients were calling us that there was really, I think they were very fearful in the beginning, really not understanding what it meant to be a blood cancer patient and how to protect themselves, how to protect their loved ones if they were a caregiver or a family member. And so we really heard from patients. And so we really worked through a multimodality approach. Through our Information Resource Center, we increased our virtual reach. So we started doing webinars. We had a really great webinar on COVID with Dr. Gwen Nichols, who was our Chief Medical Officer, and Dr. Ruben Mesa. We've increased our podcast, and we've also worked, because the information was coming out so quickly and things continue to change so quickly, we actually worked to also increase our blogs. So we felt like that was a really good way to get information out quickly, so that people would have it. So our teams work together. We have quite a large team at LLS, and we all really kind of rose to that challenge to really get that information together. We were fortunate, our information specialists and our other staff at the Leukemia and Lymphoma Society, we didn't miss a beat. So we actually transitioned pretty early on. We transitioned to work from home because we knew the importance of keeping our lines open and keeping those resources out there for those blood cancer patients and their families. We also have local chapter staff who have really changed their position and have really been able to incorporate more of those virtual seminars rather than doing in person, which we know is not possible right now. They've really moved to more virtual and really helping patients to connect with others who are going through that similar situation. And I just want to point out, it's not about, we're not there to replace that healthcare team, but we knew that they were struggling. We knew a lot of physicians either had different roles or they were taking on more responsibility because of COVID. So we really focused and wanted to be a resource for patients so that they could get the information and support that they needed. And we know that that was an issue as we were moving into COVID, and hearing from the patients and caregivers and their concerns and questions.
Well, I mean, everything that you have said, really took a great deal of courage and manpower. And I think too, when you think about all of the organizations that have been affected, I can't even consider one market in life, whether it's retail, restaurant, education, schools, higher education. There really isn't one area that hasn't been affected deeply by, COVID. And again, overnight. And the places where you see impact has remained, and even in some ways strengthened, are the places where you see that the people that power those changes are they're in it. They want it to work. They're thinking outside the box. They're burning the midnight oil in making things happen, because blogs don't write themselves, and podcasts always need a great deal of tech support, as well as the people on the front end. So it really does speak to the passion and power of the Leukemia Lymphoma Society. And I have, in preparation for this, when I knew we were going to be doing this about a month ago, I started following Dr. Nichols and listening to a lot of her podcasts, and I just find her to be such a star. I mean, what a light she is for the community. So I thank you, Meredith, for sharing that. Peggy, talk to us a little bit about some of the practical ways that you changed the way you engaged with patients, especially since your organization is so hands-on and it's so logistically powered. How did you respond to basically a shutdown in traditional ways of communication?
So we're national, and we had already been moving toward more remote programming. We had started a podcast series last fall called Marrow Masters. We had 2 seasons under our belt by the holidays, and as the pandemic was beginning, I was about to start producing all my next 3 seasons of podcasts. So as far as, programming, we were able to not miss a beat getting that going. But what really was incredible was we decided to do a few special call-in programs called Lunch and Learns. So we did our regularly scheduled one, but then we added 2 COVID ones, and I could not believe the response. Our Lunch and Learn format is the 3rd Wednesday of the month. Everyone calls in for an hour. We get sometimes 400 people registered for a Lunch and Learn, and they're recorded so they can go back later. But we did one on April 2nd that was guidelines and coping strategies. And we used an incredible healthcare provider from Cleveland Clinic, Christina Ferraro, and she just nailed it. It was timely. It was what we all, at that point, it was all about masks and hand washing. And we had I think we had 200 or 300 people listen in. And then, we just kind of waited to see what was going to happen in May. And then we felt the need to do another one called Moving Forward in How to Live and Thrive and Stay Safe with COVID-19. And we used a doctor from Seattle Cancer Care Alliance, Dr. Laura Connolly Smith. And what was incredible was these doctors were so willing to share and do a lot of homework and research. We had questions come through the queue in advance when they registered. So we were able to really shape the program by what they really wanted to know. And there were themes that really showed where people were together in all of this. So those were 2 ways we really rose to the occasion. But we also, I meant to say this in the beginning, one of the things I read this incredible article, and it said, check on your tribe. And so I had my staff, we literally spent 2 days. It was probably 2 of the best days I've had in 5 years. There was nothing we were asking of people. We just checked on people. And in those conversations came the most incredible relationships. Like, it wasn't an ask for anything. It was, how are you doing? Is there anything we can get you? Can I get you a peer? Can I get you a book? Can I tell you about a program we have coming up that's free? And I think that was really powerful to just check on everyone. And people were so thankful to get a phone call because we all wanted to talk to somebody. If there was ever a time to pick up the phone and call someone, it was then, because everybody was sitting home wanting to talk to somebody besides their family. So it worked out pretty well. So I think between, we've got webinars coming this fall. We're working on, again, our podcast, our Lunch and Learns, and we're just trying to be there for everyone as needed. Jen is busier than ever, just trying to connect peers and doing some one-on-one counseling. In fact, she's had some frontline nurses that she's counseled just how to get through the day, in the early weeks of the pandemic. So I'm proud to say that a combination of all those things, we didn't miss a beat, and we're continuing to figure out what the next step is as we all get through this together.
I love that. I wrote down so many little things, takeaways for me, almost like as to-dos, because it is so true. I mean, we all went through kind of the stages of grief with this in different ways, no matter who you were. And, I think collectively, we've all gone through, that stage of depression in that, when am I going to get hugged again by someone outside my 4 walls? And that, I read, there was a Facebook post, which I'll see if I can find and share with everybody watching, that said how to give a hug post COVID-19. And I mean, it kind of stopped me in my tracks. There were these cartoon pictures of people, one with one face this way and another face the other way, but it was like that embrace. And I'm looking at these cartoon pictures, and my eyes are filling up with tears, and I'm like saying, texting people going, I can't wait to see you and give you a hug again. So it's so true that even, how you were saying those 2 days were so meaningful. I think it's because we took so for granted the power of connection. And here we are now being reminded of its power. And I hope that when we come out of this, or as we come out of it, we never again take for granted those things, because they really are what kind of power our souls. So I think that that's so beautiful, the way you and your team checked on your tribe. That's awesome. Jackie, same question for you. How did Imerman Angels respond? And I kind of want to tie that back to one of the things you said in your opening, not one of the issues you have, which I think is an issue even with an organization as big as Leukemia Lymphoma Society. Not enough people know, and not enough people know, you know, how to reach you, where to reach you, when to reach you, how to get involved. So talk to us in terms of what you did to innovate during this time, and then what you hope to do to help other people know that you're out there and that these are the services that you offer.
Sure. Yeah, so it's all about the power of connection, right? So that's our mission, you know, right there. And our staff is really tiny. We are global, but we have 9 people on staff. So, and we only have 2.5 people, or almost 3 people connecting, doing all the matches. So it's very tiny. So we were able to mobilize outside the office. We just finished our 13th week from home, which is so crazy to hear.
Wow.
I just counted it because I was like, how long have we been home again? You know, I have to say that Imerman acted quickly because we have, you know, survivors on the team, and we have caregivers on the team that live with people that are going through cancer right now. Me, myself, currently. My sister is currently going through cancer. So, you know, this is a very sensitive time. We have to be extra careful. And so we jumped to it definitely quickly. And I appreciate the organization for recognizing the need to work from home. Our mission hasn't really changed because we were always on the phone, using the internet, emails. So all of that has basically stayed. I know a lot of organizations are like, what do we do now? We can't meet in person. And so that hasn't changed for us because that's what we're doing. One of the things that we did do, though, which is in our core values anyway, and we've always tried to really collaborate, which I said, you know, earlier, we always worked with NBMT, and we've always worked with LLS. And so now we're doing that a lot more. And so what we did was, our organization is not, it's a little different than these two because we're not just blood related. You know, we're in over 145 cancer types every day we're matching. And so no matter what rare cancer type you may think you have, you know, people can contact us because I guarantee you we'll find it.
Yeah.
To get you connected to someone. And so one of the things that we thought would be really helpful was to create a resource page that collected all of that information at one time. So meaning, you know, it could have leukemia, it could, and we definitely have posted about what, you know, LLS is doing, what is NBMT doing, and what is, like, we work with Bright Pink, all different organizations in one location. It's not about us, it's about who we serve. And so we serve so many cancer types that we couldn't just talk about us. And so what we recognized was that this was awesome. You know, why recreate the wheel? All these amazing organizations are already doing these new webinars and new, you know, podcasts and such. So let them do that. We're just going to be that center that kind of connects everybody to those resources. And our audience has, like, overwhelmingly, like, said, this is great. Thank you so much. It was funny. We actually had one of our prior support seekers, so somebody that was looking for support that we matched. She was a writer for Essence magazine who lives in Paris, and she ended up posting the resource page on it because it meant so much to her. She thought it was so useful. So I would say that that has been amazing because it's more collaboration. With each of those resource pages, we have to reach out to those organizations and say, hey, what are you guys doing? What's new for you? What's important now? And our patients and our caregivers and previvors are coming out to us and saying, thank you so much, because now I don't have to go to the bazillion organizations.
Yeah. And sometimes they can't find them. Sometimes they can't find them. So
yeah, so it's been
incredible. Jackie, how do people find that? How do people find that catalog of information?
So we email it out to people that are on our newsletter. So they would just go to our website and register for the newsletter. Or we also post it on our Facebook page.
Okay, so, great. And your website, shout it out.
Sure. Our website is www.imermanangels.org. So that's our website. And then our Facebook, Imerman Angels, super easy.
Good. Wonderful. I think that that's so fantastic. Again, I mean, I've had the honor really of meeting so many representatives from all sizes, all diseases, all impact patient advocacy organizations, and I continue to be blown away at the collaboration that takes place, and just the level of resources that are available. I mean, everything you could possibly think about: psychological, social, practical, financial. It's incredible that you rally around people probably at one of their most vulnerable times in their life to say you're not alone. And not only are you not alone emotionally, but don't think that you've got to kind of lift anything by yourself without knowing that there's people here around you that can offer resources. So I think that that's phenomenal that Imerman had that foresight to be able to, catalog what other people are offering and say, look, we're a one-stop shop for how you find what you're looking for. So that's really incredible. So, I was on this mix and mingle webinar. I don't know what we're calling everything these days, but it's like the Zoom-based mix and mingle. And it was a colorectal program, and they had people sharing their stories. And so, I signed on really not even expecting to know, or not knowing what to expect. And I sign on, and I'm probably maybe 15 minutes late. And when I sign on, there's 50 to 60 people already on. So, it's the squares times scrolling to see everybody. And there was a woman who was talking, and she was from a very small niched advocacy organization. And she started sharing a story of a volunteer that they had that kind of walked with them from diagnosis to treatment to survivorship to recurrence. And she was sharing that this particular volunteer just passed away. And there wasn't a dry eye on the Zoom. I mean, you saw so many people kind of clicking their videos off because everyone was getting so emotional. But it not only highlighted the power of advocacy organizations and what they mean to the patient's journey, but it highlighted what individuals mean to advocacy organizations. So Meredith, as you direct and lead that first line of when someone calls in and says anything that they're saying, I was diagnosed, my mom was diagnosed, I'm looking for information, I'm high risk, whatever it might be, maybe share with the audience information of, what happens during that call, and then how do you help them connect with the information that they need?
Sure, and that's a really great question. So when any individual reaches out, and we serve patients and their loved ones, so it's the whole family. We know that cancer affects the whole family, so we certainly do serve the whole families. So when someone reaches out, an information specialist is there to help them, and that's the team that I lead up. And so an information specialist is really going to provide one-on-one personalized assistance. So when that person calls in, we're actually going to address what they're calling in about. Some organizations I know are scripted, and so they're kind of walking through their script. With our team, we want to provide the information that you need. So if you're calling in for support resources, we're going to make sure that you can get those support resources. If you're calling in for disease information, we're going to start and get that disease information, clinical trials, financial resources. Whatever your need is, that's where we're going to start. And my specialists, because they're social workers and health educators and nurses, and they've been doing this for a really long time, that's a really great team. I think that they really build a nice rapport with that person when they're on the phone. And so when they're saying, well, I need financial assistance, then it turns into, well, I'm having maybe difficulty talking to my doctor, or I need help finding a clinical trial, or I want to connect with someone else that's been in a situation like this. So we're happy, and thankfully we have a lot of resources at LLS, but then we also know of the other resources that are available, and happy to help individuals connect with those other resources. So you know, we'll talk through them, we'll send them emails, we have information that we can mail to people. Whatever is the easiest for that person to receive that information, that's how we want to get it to them. And I think it really does come down to that personalized assistance that we're providing and making sure that people are getting the care that they need. And then we'll, you know, follow up if need be. We also have a team of field staff that will connect after us, and they'll make sure that they get any of those local resources that maybe we didn't know about, maybe a smaller, you know, community resource that they'll make sure that they connect with that individual for. So that's really how we work. The best way for people to reach us is by calling us. That's usually the easiest, because then we can actually have a conversation, really see what resources are available for you. What I find is a lot of people call in about one thing and then they don't realize all the other resources that are available to them and can really support them. So we want to make sure that we're giving them everything that they need. And our phone number, it's 800-955-4572, and we are there Monday to Friday, 9 a.m. to 9 p.m. We want to make sure that we are open late so that we can accommodate the West Coast as well. So we do have those extended hours.
Thank you, Meredith. Peggy, a similar question along the veins of, you know, there's an individual on the other end of that line, and in most cases, or I should say in many cases, unfortunately, so much of cancer is familial, but, you know, in many cases, this is all new to them. How does your team help support that person calling in to navigate them to where they need to go and kind of stay by them? You mentioned your peer mentor program. How does that work for patients who need this resource?
So our Jennifer Gillette often will call, or, you know, one way or another get in touch with the person that's needing assistance. And like I said earlier, she'll do some one-on-one time. She will figure out in her directory who would be a good fit for, you know, someone that's already walked that walk, had the same diagnosis, you know, and so often these peers are buddies. They're on the other end of it now. And we had one gentleman, Barry, I'll never forget it. He talked to 5 of our peers, and I know Jackie can relate to this. He lived in a very rural area, and he was so worried about his wife. He was her caregiver. And by the end, Jen had connected him with 5 different people to talk to. And it was one of the most rewarding things in the 5 years I've been here, was an email he sent to our team saying, "You guys got me through this. I used 5 of your buddies, 5 different perspectives on 5 different topics. And I just never could have gotten that support had I not known about groups like yours, and of course, Imerman Angels." And by the way, Jackie and I, it's so awesome. We will email each other, or she'll email Jen if there's someone she needs a peer that we might have access to, or vice versa. So it's very collaborative to work together. And of course, LLS, we do so much with them as well. But we're just, not only just the peer support, we're doing blogs. We recently kicked up our social media presence so that we're offering really reliable resources, articles. We're throwing questions out for people to share ideas so that they're not feeling so alone. That connection on social media has been another really powerful thing, I think, during this pandemic. There's so much out there, as we all know, but when I've noticed our followers trust us, because we're just posting the facts and the CDC type stuff, very, very reputable. And finally, I might add, we also have a very interactive resource search engine on our website, which is mbmtlink.org, where people can plug in their diagnosis, what they're looking for information on, and it narrows their search to, you know, 2 or 3 main places for them to get in touch with. Like, for example, if it's financial, I just have to say everyone should make sure they know who Triage Cancer is, because they are phenomenal. They're the leaders on anything to do with finances. And that's where I think we all know our strengths and what we're good at and what we're trying to do. And we work together to make sure the patient is getting, and the caregiver are getting, everything they need collaboratively.
Thank you. And Jackie, this is the last question of this session until we all come back for Q&A. But, you know, both Meredith and Peggy really noted the importance of credible information, either getting on the phone with people who have been there, who know the resources you need to connect to, like Meredith's team does, or as Peggy mentioned, you know, using information from credible sources to share out with people during this time where they're, you know, social media, you could almost, if you stayed on it, you could almost need a psychiatrist. Thank God they're doing that telemedically now, for, you know, navigating through all of this doomsday stuff. How does Imerman focus on what's credible and connect people to who's credible when you get those first touches from patients?
I would say, I mean, one of the benefits too is our people, also social workers too, but also have a personal experience. So it puts a little passion behind the work as well of the education, and that does help. And so they themselves have, you know, most likely used some of the services, so that helps. Or just over the years of working with people, knowing who's been there for a while and who can provide those credible resources. I mean, we've connected over 30,000 people over the years. And so they come back to us and they'll say, you know, this organization has helped me. And so really like word of mouth from the testimonies of those who have been there. I mean, again, back to our mission is just hearing it from the people, understanding that the people are saying these organizations really helped me, or this organization not so good, and so then we don't do that.
No, I love that. I love that people can look at you as a partner, and I'm sure they stay connected, or at least reach back out to say, you know, thank you, this was my experience, and, you know, it's wonderful to have you there, because it is so overwhelming, the number of resources, and you don't know who's who and who's powered by who and who's sponsored by who. So, you know, just having Imerman there to kind of be that first touch, where no matter what cancer you're diagnosed with or caregiver of someone going through that, it's like, okay, well, at least we have this resource that we know can point us in the right direction. So I think that that's fantastic. All right, well, ladies, I told you these sessions go by so quick. I mean, I have like 3 or 4 more questions that I didn't even get to touch on. So hopefully other people will touch on them in the Q&As, or when we get round to the end, I'll bring up the ones that I think are the most important. I'm going to ask my team to bring up Dr. Mauro and Dr. Vidge, and then we'll circle back. And girls, by the way, when you are in between, feel free to get on the chat and answer any questions that people might have. Okay, fellas, thank you so much for being with me this Saturday afternoon. The audience certainly has been looking forward to this time together. In fact, as we were doing a lot of more solid tumor focused town halls, we had a lot of people saying, what about blood cancers? And so we've been looking forward to this. And we were also happy that this came post ASCO, the big educational event for cancer, because we thought that, you know, this was going to be a really exciting time for people to be able to look back and see all the innovations that are still happening, even though we're living in a world where, you know, a lot of things are uncertain. So I thank you both for joining me. We have Dr. Michael Mauro from Memorial Sloan Kettering in New York, and Dr. Ravi Vidge from Washington University in St. Louis. And I thank you both for being here, and I want to just dive right in with both of you. You know, Dr. Mauro, we were talking a little on before as we were doing the prep call just about New York and New York's experience that probably is different than really anyone else in the United States regarding COVID-19. Now that we're, I don't want to say beyond COVID-19, because by no means do I think we are, but now that we've got the perspective to not kind of be living right in the middle of, you know, the unknowns about it, can you talk to me and our listeners on how COVID-19 affected clinical practice when it came to blood cancers?
Oh, where do I get started? I mean, the impact of COVID, I think COVID-19 has been for everyone, but I think everyone's felt it differently and needed to react accordingly. In New York City, I think people watched us react live on TV for the most part because they were seeing our governor and our worst case scenario hospitals saw the pain and the stress of lack of personal protective equipment. You know, after a little while, I started to tell people what you're watching on TV is real. That's actually what's happening. But specific to blood cancers and leukemia, I think we had fell into the fold of cancer care. I'm at a cancer center, Memorial Sloan Kettering, so that is our mission. And it really meant a very aggressive, quick, but but calm, cool, and collective approach to say, well, how are we going to manage this? You know, and at first was damage control and understanding how to manage a pandemic in a blood cancer patient population and in a cancer center. The patients we're dealing with, a lot of them are long hospitalizations for intensive chemotherapy. There's a lot of link to the allogeneic transplantation part of our hospital. And so I'd say one thing that I think people with leukemia or blood cancers probably tend to be a little bit more, as I say, dialed into the fact about what immune suppression and precautions mean. So I don't think in some ways it wasn't as hard because I think a lot of patients weren't surprised to hear that they needed to start wearing masks and gloves and that their teams were going to look quite different, that some of the hardest things were visitors being limited or eliminated for a long period of time. We're just starting now to introduce some visitation in the hospital for very certain circumstances. But I think what really you were asking about is we had to adjust our care. We knew we couldn't start treatment in patients the same way we wanted to. We couldn't move people through a treatment algorithm the same way we wanted to, moving them from one treatment to the next or one treatment to allogeneic transplantation or other modalities. So we had to look at our inpatient beds. We had to look at our outpatient clinic capacity. We had to look at our blood supply, which ran quite low. We had to look at it boggles your mind because every encounter you think about, all the things that are linked to that are almost unsolvable. Say you have a patient who lives in Brooklyn who needs to come to Manhattan for a transfusion. How are they going to get there? Who's going to come with them? What's going to happen with that person? Do we have capacity? Is it safe? How's that person going to be managed? Do we have enough staff and equipment to manage them? Do we have the blood? Can they get back home? There were so many different things to think about. But overall, I think, the hospitals in New York, and I think hospitals around the country and around the world really, just calmly, collectively said, how are we going to do this? And went into a little bit of damage control and then followed it with a very careful prioritization and reorganization to say certain things just have to happen. We can't not have these things happening. Certain things that are on the other end of the spectrum that are quite elective and quite safe to hold off on, these shouldn't be happening. The patients themselves might have said, I don't need to do this right now. I think that should be deferred or delayed. We had to do a lot of coaching for patients. I mean, a lot of patients were very, very afraid to come to the hospital. I still have to face the fear of patients wanting to come to New York City to the hospital. And I understand that. I'm lucky I work more in chronic leukemias, and so in my practice, we adapted a philosophy of understanding that our patients were going to be under a tremendous amount of stress, and really just to pause and sort of hear them out and not push, not to be trying to coach them, say, look, your health care depends on this. We have to do this. It's okay, to allow people some space, but then to kind of bring them back into the fold and say, it's time. We have to get to do this. It's going to be okay. It was a tremendous amount of challenges. I could go on, but I mean, in a nutshell, it was a massive reorganization. It was a triage. It was a recognition that certain things weren't possible. Many things had to continue. But I have to say, there was a point in New York City where we were really on the edge of the cliff when it comes to continue to do life-saving surgery, continuing to provide care at a level where we would not let someone slip through our fingers because there was something we couldn't do because of COVID-19, but we just had to think to do it a different way, or do it somewhere else, or do it in a way we probably wouldn't think would be ideal, but it still happened and it still worked.
Mm-hmm. You know, so much of what you are saying makes you think of the patient. You know, the focus is on the patient, which rightly so, it should be on the patient, but at the same time, as physicians, you are managing so much emotionally and logistically yourselves, especially in the early days of, you know, going into work poses a hazard to the people you come home to. And so in addition to figuring out managing care and giving patients space to, you know, be transparent with their own fears and with their own questions, balancing all of that as, you know, healthcare providers, the rest of the world watched you, you know, whether it's you, Doc, in New York, or Dr. Vidge in St. Louis, the rest of the world watched you, and, you know, all these memes about heroes and things like that started coming up. But the reality is that you were being asked to do things that you could never anticipate being asked to do while managing all of the things that you were being asked to personally. And so Dr. Vidge, you know, just kind of building on what Dr. Mauro was talking about, St. Louis experienced this, you know, I'm in South Florida. We experienced this very differently than the Northeast did, but we still had to experience patients' fears. And those fears weren't only about COVID-19, you know, am I going to catch the virus? Am I going to die? Am I going to die alone since nobody is able to go to hospitals together? But also, what's going to happen to my care? Is my care going to be somehow influenced where I'm not getting the best of the best because of some of the restrictions? So maybe you can talk to the audience about the ways Wash U and your division really considered how you treat patients during this time, and how there, you know, any compromises or changes in care you had to make wouldn't affect overall outcomes.
Sure. So in St. Louis, fortunately, we never had the pandemic get out of hand, and hopefully we will not have a second wave to contend with that could get out of hand, but we certainly had to make all the necessary arrangements and not knowing which way things would evolve. So I remember that it was mid-March and I was just going on service when the full impact hit. Most of the staff were asked to work from home if they were able to, and on the floor, the procedures were evolving. We were in the mix of how to best have policies and procedures in place for a pandemic that hadn't hit us, but was likely to. There was a lot of apprehension. A lot of it, we did not know at that time what to expect. When I started out on the floor, we were actually admitting patients with neutropenic fevers to the floor. And neutropenic fever is a very common issue with patients with hemolignancies. I work in a combined leukemia transplant unit and have an interest in multiple myeloma in terms of my research. And so we certainly were dealing with a broad mix of patients, but all of them do have the potential to develop neutropenic fevers. And that is very vexing, because the fact is that COVID presents with some of the very symptoms that our patients are likely to present with: fevers, cough, pneumonia. And how do we try to not disrupt the patient's care and also not direct every patient to the emergency room where there are going to be a lot of genuine COVID cases? So we tried to admit patients, as we usually do, directly to the floor. And initially, they were put in negative pressure rooms till they were able to be ruled out for COVID. There was a very limited availability of tests, and we were often able not even to test patients that we wanted to initially. And then we went to a situation where, because of availability of tests, the hospital mandated that everybody be tested, whether there was a strong suspicion for COVID or not. Ultimately, we established separate COVID units, COVID floors. And so the majority of the patients that had any neutropenic fever were directed to these COVID floors. Within 24 to 48 hours, most were ruled out for COVID, and then they were shifted back to our units. So the inpatient unit obviously continues to have policies and procedures in place that continue to be modified. Now, I think with the pandemic, which never got too bad in our area, as I said, starting to actually wane, we are contemplating allowing, hopefully, patients' relatives to return, but still, there are, unfortunately, in the most demanding of times, no patients' relatives available. And these patients with leukemia and those undergoing transplant, unfortunately, have lengthy stays in the hospital, and they can get fairly sick. So I think that the emotional component of it certainly is challenging. We also know that for patients undergoing transplant, what was a big issue was the availability of donors for allogeneic transplant, especially through the National Marrow Donor Program. And we had to put in place a backup for literally every patient undergoing a transplant, that in case the cells from the donor centers from abroad were of low quality, first of all, we had to delay getting patients chemotherapy started for their transplant till the cells were available on site. But some of these cells, instead of taking 24 to 48 hours to arrive, took the better part of 4 or 5 days to arrive. And we often were not sure about the quality of these cells. And in 1 or 2 cases, actually had to take recourse to giving patients cells from an alternative donor instead. So I think that in the allogeneic transplant arena, certainly because patients can't usually wait to get their transplant, their disease is usually don't permit us to have that luxury, we had to do our best. In the case of autologous transplants, for multiple myeloma, we delayed admitting patients for autologous transplants for a period of 6 to 8 weeks. We did not do any autologous transplants for myeloma. We have now opened back up. These are transplants that usually can be delayed, and people can get additional therapy while they wait. So those patients are not at risk usually. So different patient groups were impacted differently in terms of their inpatient ability to get transplants.
Mm-hmm. And you know, Washington University, we manage a program there every year in St. Louis in the summer, and we follow WashU and all the different things that, you know, as an organization, you all are on the cutting edge of, especially in the area. I mean, you look at institutions like Memorial Sloan Kettering in New York City, and the expectation is that they're on the edge and that they're advanced. But when you think of Washington University in St. Louis, I mean, I'm so proud to see that, you know, your clinical trials development programs are robust, that your community outreach programs, your disparities programs, all of these areas where WashU can make a difference in your community and beyond, that you continue to. And so just hearing you talk about the ways that you started to reconsider the way you access or allowed patients to access treatment, and your teams responded to taking those considerations seriously, isn't surprising to me, but I commend you. I mean, I really commend you and the rest of your team at WashU for what you've done. Dr. Mauro, you know, Dr. Vidge talked a lot about logistics of active treatment. One of the things as a researcher myself that's really heartbreaking to me, and I wonder if you would just talk to us a little bit about your thoughts. you know, you don't think of clinical trials as part of every day. You just don't. We do because we're in it, but when you talk about cancer as a whole, you know, the average person isn't saying clinical trials, clinical trials. This pandemic has caused such an interruption in the clinical trial process, development, accrual, which is registration to trials. How do you feel we come out of this, and maybe how do you feel we put a greater emphasis on screening patients for active trials and still reaching patients to let them know that in some places clinical trial departments are reopening?
Well, we try to think clinical trials all the time, and a center like mine, WashU, we want to be able to offer something novel, something potentially better than what we know we already can do all the time. But obviously, it was a tremendous ground stop for research. Much like the analogy I was saying before about a patient who lives in the five boroughs who needs a blood transfusion. If you say, oh, I have a clinical trial, and how do I affect that? All the different facets of that patient, from where is the research coordinator? Are they at home or are they in the hospital? The consent form, the study specific tests that need to be done, the experimental therapies, any kind of supportive care that needs to be offered or monitoring. So much like everything else, especially in New York, I mean, we had to do a very rapid but pragmatic and unfortunately, somewhat blunt ground stop for much. Again, life-saving and vital research, in some ways had to continue. No one's experimental therapies were stopped, but new experimental therapies, whether that was a real challenge. Research labs shut down entirely. I mean, entire elements of the hospital, medical centers, because that wasn't safe for people to be only the essential parts of the hospital, say. So that being said, practicing clinical medicine throughout the whole time. I've been in New York the whole time. I was separated from my family for 2.5 months because of that, because they needed to not be in New York. I needed to work on a COVID unit, but we had hundreds of patients in Sloan Kettering. We had multiple different ICUs that we were running. And you were saying before that had to happen. But on a good note, I take care of a lot of patients who are out of the hospital and who have chronic illnesses and are doing really well, chronic myeloid leukemia, myeloproliferative disorders. We didn't really miss a beat there. We just had to change entirely the way we practice medicine. I haven't seen a patient in person for the most part, in a couple of months, which is really bizarre, but it's working because you can do a lot with someone by just communicating with them. So research took the same approach. I think research may take the same approach, what I was getting at. I think we've taught ourselves the way we were doing research, where we were requiring patients to travel for certain things, where they were having every single test done at a study center because of a framework that we set up that we only, a CBC here is only good, whereas a CBC from there is not good. I think it's going to force us to look at the way we look at clinical research and what are the key elements, what things must we do a certain way, and what things have we learned we might not have to do exactly that way and still be valid and scientifically valid and safe. So as we reopen, not surprisingly, it was a matter of things become very pragmatic in a pandemic. What is paradigm shifting? What new studies have a signal, are showing efficacy, are actively accruing at our top priority trials? Those are the things that needed to be open. Things that were sort of unknown, where we didn't understand what the benefit to the patient might be. You have a hard time making an argument to yourself, how do I triage that clinical trial? All trials are almost open now. We went through a phase much like the opening of cities is happening, where there's a phase 1, phase 2, phase 3. So, but it's still operating in a new world. Patients are being shipped study medication. I'm doing a lot of PDF and video of consent forms. That's fine. I think we can do that. I think we've taught ourselves a new way to practice medicine. So I think research will, much like Andrew Cuomo says, we need to get smarter about the way we're doing things in New York and not just say we're back and we're doing it again. Who knew we could clean the subways? Who knew we could do consent forms by electronically and really ship drug? And it's not going to be the end of the world. They're going to get to the patient safely, and they'll be fine. I don't want to undermine the science and the safety of clinical research. So that is the most important part of research. But I think the pandemic has taught us that we can do it a different way. And I think, well, there was quite a harsh shutdown and a reopening that had to happen, and it followed the same rules as how do you, almost in a wartime mode, how do you take care of patients in a hospital? Research can be reborn in a new way.
Well, good. That's so encouraging, especially coming from, such a prestigious research organization as Memorial Sloan, that, you're looking at this and saying, not only can we come back stronger, but we can come back smarter, and we can certainly start to impact maybe patients that traditionally couldn't or wouldn't be considered because of restrictions. Maybe they didn't have adequate transportation, or maybe the communication level that, you would have had to do for a very complex protocol. Now we have innovated to the place where we can take the life-saving research opportunities to them instead of them having to come, figure out how to access it.
If I could just add one more thing. The other beautiful thing that happened in New York is, the hospital's operated as a community. We have such a large burden of patients. We just have to take care of those patients. So, Elmhurst Hospital patients with cancer came to Memorial Sloan Kettering. We wouldn't do that in the past. If there was a transfer, sure. But I think we have to look to be a healthcare team collaboratively in the U.S. and around the world, where it's not just that it's our research, it's a field. We all want to be doing research, so partnering with a variety of networks and community hospitals and other providers, sort of looking at that differently too. It was something we were thinking of. Something like telemedicine or telehealth, we were all thinking that was a great idea. And now that it became an emergency and it was like our lifeboat that we had to get into, we had to get comfortable in it. So now we have to get comfortable saying, just what you were saying, could we do research in a different way where someone exactly who lives in Iowa doesn't have to come to Manhattan, even if they are enrolled in a clinical trial for every week, for the first 12 weeks? Why? Is there something we could do differently? And can we do it smarter?
Yeah. And, necessity is the mother of invention. And this has taught us all, necessity, the things that we, as a med ed company ourselves, how do we continue to provide information to people who we now can't get all in a room for a half-day conference? It's like everybody has to just start to say, well, there are ways, we just have to be able to identify them and execute them. But on that same, Dr. Vidge, Dr. Mauro was talking about telemedicine. This is kind of the newest old thing ever. Telemedicine was here in so many ways. You could access an urgent care doctor, you could access, psychiatrists, etc. But we never were pushed to have to do that in oncology. And I think for so many, especially interim visits, follow-up visits, visits in survivorship, there were opportunities where, if a patient who started with you in St. Louis and then moved to Central Florida had to establish new care somewhere, but only were seeing their oncologist twice a year. Now they could potentially, in a new world, in a more efficient world, they could potentially keep the care with you who treated them all throughout their active treatment. How have you seen telemedicine evolve in oncology over these last 2 months, and what do you think the role of it will be as we start to normalize clinic visits going forward?
No, I totally agree. I think that telemedicine's been around, the capability's been around, but it has been not utilized partly because of policies that have also prevented its mass utilization. It is heartening to see that it was pretty rapidly decided that people could be legally allowed to consult across even state lines. In St. Louis, we have a substantial population that comes from Illinois, and one of the reasons why telemedicine hasn't taken off is the provider has to be licensed in the state where the patient is seeking an opinion. And so these kind of barriers have prevented the growth of telemedicine. And it took this pandemic to make it happen literally in less than a week. We were licensed in the state of Illinois to provide telemedicine. I think that the other thing has been the reimbursement of telemedicine. Unfortunately, everything does have to become also financially feasible, and for telemedicine to take off, you needed to have codes wherein you could bill insurance, bill CMS for these consults, and these were also rapidly put into place. I think that as far as research goes too, I think that the policies that were put into place may in other times have taken years to be allowed. We were fortunate that in the institutional scientific committees, the review boards, realized that patients on clinical trials couldn't come to keep the appointments that were mandated by these studies. And in normal course, if that didn't happen, you would be at great risk from the laws and from the oversight agencies. And now you were literally within a week allowed to consult on patients remotely, allowed to have them get labs drawn, as was mentioned by Dr. Mauro, at another institution, where in the past that would not have been possible. So the other thing is also that the FDA also realized that reporting of some of these adverse events may not be watertight. And so you certainly need rigor in scientific research, but you do need to also be able to modify your policies at the time of pandemic, and those kind of things were done. Remote monitoring of data, the thing that happens behind the scenes in any clinical trial is that the pharmaceutical sponsors have to come and monitor patient data is being collected properly, and institutions have very stringent policies on how they will apply remote access to electronic medical records. And that also happened very rapidly, that the sponsors were allowed to access medical records for monitoring purposes, which was otherwise going to take a long time for institutions to change their policy. So I think all of these things came together to make the research enterprise happen, and telemedicine played a vital role in various aspects of this, both in clinical care and in research.
Mm-hmm, mm-hmm. Well, I do hope, as we go forward, I do hope that, especially when access is a burden for patients, you've got patients that can readily have family or friends drive them to visits, or maybe they live close to accessible care. And then you've got this, great population that we've been talking about for so long, this disparate population in rural areas or poorer areas that don't necessarily get the same both access and quality of access to care. I really hope that as we go forward, both from a research and telemedical perspective, that much of what we've seen in innovation in both areas remain. Dr. Mauro, I'm going to shift gears a little bit because, this is a patient-focused webinar. Worry and anxiety for people throughout these few months, and here we've got now this political uprising in social issues that's calling people out in quantities, in protests and things like this. When you are thinking about balancing who you are as an individual and then who you are as an individual with, a cancer, can be difficult. You want to be able to empower your young 21-year-old kid to go out and march for what they think will make change. But at the same time, you're fearful about, COVID-19 is still here. There hasn't been any advances on treatment, on vaccines, although we'll be happy to hear what Pfizer and other organizations are doing a little later in the webinar. how do you counsel patients who say to you, I'm worried, I'm anxious, I'm scared, I'm fearful? What's your advice to them?
I actually just answered a question in the Q&A but just a moment ago about the exact same thing. And I think the first thing I'd say is the most important thing to do is to acknowledge. Since I still talk to people all day, I had my clinic yesterday, and it was sort of a dawn to dusk telehealth clinic, and I now feel like I need to check in with patients and talk to them about that. I'm including information that I think they all maybe intend to ask me, or they wanted to know, like, so how does it affect me? What about my leukemia? What should I be doing personally? Thinking that I know them, I know who they are, how they operate, what their circumstances are, what their abilities are. But just acknowledging that they're thinking about that they're worried about that. I usually try to be light about it and say that, ask them how they're doing, and then if they say they're okay, I said, you know what, I said, everyone asks that the same question to each other, how are you doing? And I said, anyone that says that they're okay, they're lying, because nobody's okay. Where everyone's in this, in the same boat, sort of not so sure it's sinking or afloat or leaking or what's going on. So there's so many things that people can't reconcile and kind of find a path forward in their mind to make a decision. They feel strongly, or they're emotionally driven to show their support, which I support personally, for what's happening in the country, and which the timing is probably the worst it can possibly can be, because it was a time when we needed to have a peaceful time, when we could have all the flexibility to not be pulled out of our homes or pulled out of our isolation, and to make our voices heard. But that's almost the same as, should I go for a blood count, or can I go visit my, can I be with family or friends? So it's all in the same, it's all important. So I think acknowledging that there's fear about that, and then looking at each person's, what you know about them and what they should or shouldn't be doing. I mean, as healthcare providers, you have to really try to tell people the truth and the best information available. Honestly, which we really don't even have information. I say quite often to people, I don't know. That's probably more the answer, rather than a data-driven answer about what should I do. I think I always, when it comes to patients with cancer, I think the two most important things I try to convey are, let me be as clear as I can about what I think your individual risk is, because I think there might be exaggerated fear about that I am in a very dangerous place and I can't do anything, and I think that might deteriorate someone's quality of life. That may take away their willingness to stay really engaged with their treatment, which is very complicated. You have to work harder at treatment now than you had to before, because you have to stay on top of it. If you're clear with them about what their risk is, and then you kind of just talk to them as another human being, like, what can I tell you? What do I know? A lot of people look to us as physicians to have all the answers, and we don't. When it comes to the pandemic, we're all learning as we go. We all became COVID-19 physicians. We take care of patients in the hospital, but we've never seen the infection before, and now we're figuring out a new way to work around it. So I'm not sure if I answered the question, but I think it's important to acknowledge and listen, and then just convey the best information, and take it one day at a time, one step at a time.
Yeah, no, I think that you did. As you were talking, I wrote down, because I take notes as everyone's talking, and I just wrote down acknowledge. And I think I was thinking as you were talking, what a powerful word. You could almost just use the word as the prompt, because it's acknowledging everything. It's acknowledging my fear, my feelings, the surroundings that I'm living in, my interaction with you, and how I have viewed, my healthcare team as really my lifeline during this difficult time in diagnosis. And Dr. Vidge, I'm gonna, ask you the same question. If I'm a patient active under your care, and I call you, in addition to what I think so beautifully Dr. Mauro summarized as just acknowledging each other, that we're both humans, we're both experiencing this very uncertain, very strange thing together. And where once, you may have been the person who comes in and I'm seeking all of your expertise. Well, now you're in a position where you don't necessarily have the expertise for the thing that I'm asking because it's so brand new. What are you saying to me, your patient, about helping me manage or mitigate some of my anxieties?
Yeah, that's a very difficult question. And as Dr. Mauro said, one of the things that we do have to admit that there's a lot we do not know. And I think that most of the stuff that people hear in the news, read through the news media, is what we essentially are able to tell our patients, that good hand washing, wearing a mask, keeping social distance, is what we have to do. Now, in one way, we in the St. Louis area have been fortunate, as I said, that the pandemic didn't get too bad. So I can reassure my patients, which I guess Dr. Mauro can't, that we've had very few cases among our patients that have led to any adverse outcomes. And so I think that right now, what we are actually starting to do is open back up, and our clinic volumes are back to about 80% of what we used to see before the pandemic, after having gone through a period of heavy reliance on telemedicine. But what we are starting to do is extend the clinic hours. We make sure that patients are seen on time so that they're not waiting in the waiting area. We're taking extra precautions in terms of cleaning of the rooms. We're talking about possibly even to space out patient visits, having clinics on the weekend to see the patients so that they're not, again, piling up in the waiting area. Our patients are also back in terms of getting autologous transplants. So we're reassuring them that we did not have any adverse outcomes. In fact, in our transplant unit, beyond what we expect with stem cell transplantation. This is an area where we actually over-prepared. We actually had our occupancy in the hospital go down, anticipating a surge which didn't happen. We, for a 2-month period, had literally none other than emergency surgeries. And now the surgeons are back in the operating rooms. Obviously, policies and procedures are being put in place to get patients safe during their post-operative and pre-operative period. They're being screened for COVID before every patient is going to surgery, before every patient is being admitted for a transplant. So these are the precautions we're taking, and the precautions I think will evolve with time as we get more data. At some point, antibody tests, once they become more reliable, and may also have a role in reassuring patients. So we'll have to see.
Yeah, my takeaways from both of you, and first I want to just say thank you both for being here and not just sharing your medical expertise, but just kind of sharing your heart a little bit about your passion for what you do and your love for your patients. It really comes through. In fact, there was a note on one of the social media channels saying that they really just love these two doctors. And I do too. I mean, Ravi, I work with you every summer, so I get to know you. And Dr. Mauro, you and I hopefully will be working on this other project together. I think you both are fantastic. I really couldn't have been luckier to have the two of you on this Leukemia Town Hall with me. But I think everything that you've been sharing, for the patient, from the patient perspective in terms of how to balance risk versus life, benefit, living, not being scared, not taking into consideration that, in St. Louis, we haven't seen the same type of, volume of cases. And so don't be afraid to live, still go out and go to the park and, take those walks and don't feel like you have to be isolated into your home. This really matters to patients, hearing from doctors like you that, that you all are considering risk versus benefit in not just treatment anymore, but in, how you advise patients on how to live. So I thank you both for being part of this session. I ask you to, stay where you are because we'll come back for Q&A together. And as I ask my team to introduce our Pfizer VP, I again want to ask everybody who's watching either on social media channels or on the Zoom webinar to continue to keep your questions coming for this panel, because it's certain, and at the end when I go through Q&A, for those of you who can't see on the webinar, I will take the questions and re-ask them so that you get the benefit of hearing what we are discussing. So now I have the pleasure of being with Dr. Roxanne Ferdinand from Pfizer. Dr. Ferdinand, thank you so much for being with us today. You are now one of the many medical representatives at Pfizer that I've had the honor and pleasure of working with. And I keep my eye on what Pfizer's doing. I'm so excited now that I've looked under the hood of the things that you're doing. And I want to share that with people that are listening, because I think when especially a lay person thinks of large pharmaceutical companies, you almost pocket them into what you think you know about them. And when I first did one of these where Pfizer had a space for Q&A, I actually invited you all back because there's so much that you're doing, even in vaccine development, that I never connected dots on. And I want people to be encouraged that we are being looked after by large, competent, credible pharmaceutical companies that are working tirelessly, not just in the pursuit of what you were already doing, like cancer innovations, but now throwing your hat in for COVID. So thank you for being with us, and tell me a little bit about what you do at Pfizer, and then we'll go into what Pfizer is doing and how you have developed your plan to reach the community.
Sure, Sarah. So thanks so much for having me. It's a real pleasure to be here with the panel. My name is Roxy, and I am the Global Medical Lead for Hematology Cancer franchise. I've been at Pfizer now for 10 years. Prior to that, I'm a hematologist based in the UK. And prior to that, I was working as a hematologist in London.
Wonderful. So, Dr. Ferdinand, I want you to talk to us about what Pfizer's doing. I got to hear a little bit from some of your colleagues. What are you doing to reach the community now that we are navigating through this pandemic together?
Sure. It's amazing to me listening to Dr. Vidge as well as Dr. Mauro and Peggy and Jackie and Meredith that there's so many parallels in terms of what we are doing as industry with what the patient advocate world is doing as well as physicians. So at Pfizer, we're doing what we do all day, which is drug development. So we have really marshaled the greatest minds that we have, as well as collaborated to try and find solutions to this pandemic. So very excitingly, you may have heard about our collaboration with a biotech company called BioNTech into the production of a vaccine for COVID-19. And this vaccine, I'm very excited to say, is now in the clinic with patients in phase 1 and phase 2, both in the United States as well as in Germany. So on both sides of the pond. And we're really excited about this platform. It's very innovative. Instead of kind of traditional vaccines where you put an antigen, we're using instead the genetic sequence of the virus to cause immunity. And, listening to Dr. Vidge talk about breaking down barriers, it's amazing to think the genetic sequence of SARS-CoV-2, which is the virus that causes COVID-19, was only known in January when it was released by Chinese scientists. And we are already from bench to bedside in the clinic with this new initiative. And we've never had an mRNA vaccine actually make it into a currently available vaccine. So this is a new approach, but I think if there was ever a time for us to be bold and to really harness everything we have learned about about genetics and molecular understanding of viruses, it's now. Now is the time for us to be bold. And so we have this ambitious program where we are testing 4 distinct vaccines in different doses to hopefully give us really the best chance of finding the best vaccine at the best dose to really be successful. But I think importantly, on top of that, we also think about utilizing our manufacturing capabilities, because the need when we find a vaccine will be enormous to get this to patients. So at risk, we are at the moment, working so that we will have 20 million doses in this year and hundreds of millions of doses in 2021. But importantly, recognizing that a bit like what Dr. Mauro said, we need to work as a community and recognizing that we may not be the only ones who are successful. And so we have committed to using any spare manufacturing capacity to also use the breadth of a company like Pfizer to be able to manufacture for other companies that have successful either antiviral treatments or vaccines, so that we can get these medicines to patients that will need it, because we recognize that actually that is going to be the first step, is to find effective therapies. The second step is to get it to patients. In that same vein, we have also recognizing some of the unique challenges that patients face at the moment. We have adapted in the United States our patient assistance program so that patients we can ensure that they can access their medicines that their physicians have prescribed. And that's really important just from a practical way, recognizing that people are facing so many challenges at the moment. And what can we do? What must we do to make sure that patients like the ones Dr. Mauro and Dr. Vidge are talking about can actually get access to their medicines? And maybe the last thing I want to kind of highlight is about our people, whether it's taking people and actually saying, you're not going to work on this, you're going to 100% work on COVID-19, because that's what we need. That's the commitment we need. For a very personal level, we also started our medical service program, which meant that we were able to allow physicians, nurses, pharmacists, scientists to go to the front line. And as a UK registered doctor with a license to practice, I was able to register with my local NHS trust and become a volunteer doctor, which meant that I could then say, I'm available if you need me on the front line. And not in my spare time, but in my Pfizer time. And that as well, I've been so inspired by so many colleagues who have done that, and an organization that has encouraged us and allowed us to do that. So I think the collaboration that we're seeing with academics, we talk about in Pfizer, science will win. And I genuinely believe that science will win, but only if we collaborate. We collaborate with researchers, we collaborate with other industry to make sure that we use our strengths and our capabilities to make sure that we can get our medicines to patients, be it COVID medicines or actually cancer medicines.
I mean, it's so reassuring. The same way patient advocacy organizations are collaborating, using their strengths to leverage to reach, ultimately patients where they are, with what they need. And you see, organizations like Washington University and Memorial Sloan Kettering, banding together to share what they can share. I think, this has brought so many people close together that maybe didn't look at the world in this collaborative way. And just to know that, as you said, if Pfizer has a lab and we've got lab techs and we've got lab machinery and someone else needs capacity in order to kind of push something forward, why not? Like that's now is the time to ask the question, why not? So I love to hear what you're doing. I think, and I'm running over a little bit, but this is a question that's on my mind, and I know it's on so many other people's mind as well. you mentioned, you know, the speed to which we are developing vaccines, and there are so many people, this is a real question, there are so many people that say, how can we do that without compromising safety? Should I take a vaccine when it is ready and approved? What do you as a doctor, both as a clinical physician as well as someone representing an organization committed to developing vaccines for this time, what do you say to people when we ask that question to reassure us that there are no shortcuts being taken to the development of these?
I guess what I would say is kind of going back to the breaking down of barriers. I think we always did things the way that we did it, and we never questioned that. What this has done was told, it's essentially, it's made us think, actually, what do we need to do and how can we do it better? So absolutely, I think what we have seen is that if we collaborate, if we meet earlier with the FDA, if we, instead of trying to do things on our own, do it collaboratively with multiple other organizations, we can do it faster and better. But under no circumstances ever can patient safety be disregarded. And that will remain, as a company, as a physician, do no harm, the #1 priority. So I think the idea that we can't do things quickly and well, is not true and doesn't belong in our thinking. So absolutely, what we're doing is prioritizing exactly that, patient safety, to make sure that we can do it. We are investing more to make sure, for example, that we have 4 candidates so that we can really choose and know which is the best one to go forward with, rather than, for example, doing it in a sequential manner. We're doing 4 at the same time, when actually it's probably cheaper to do it one after another, and maybe you get lucky and you choose one before. So it's really about thinking through how we can do things better. And I think once the dust settles, a little bit like what we were talking to with Dr. Mauro and Dr. Vidge, what we're going to have to do is really stop and think, actually, what worked really well and how can we use that going forward? Because I think no one's satisfied, for example, with the speed of clinical trials in cancer medicine. So what can we learn to do it better, to actually take what we've learned, because we've had to do this, it's a fire drill, very, very quickly. How can we take some of those learnings and actually put them forward? How can we have better, greater equity to include more patients in clinical trials by, as they were saying, using PDFs instead of having patients come to clinic. So I think as difficult as this situation has been, I think we will come out with new solutions and a new way of doing things. And we're all involved in that process to make sure that we can do it, remembering why we're doing this. We're doing this for patients.
Yeah, we're doing it for each other. It's the first time that all of us really can see ourselves as a patient. No matter if you're the healthiest person, never been to a hospital, never been diagnosed with anything, more than a common cold, we are all patients in this moment. And so kind of aligning in that spirit and really becoming the cheerleaders of, people like you on the development side, people like the doctors and the treatment side, and definitely people like the patient advocate leaders that are doing their best to keep information flowing is incredible. Well, Roxanne, thank you so much for being with us. For this, stick around. We'll be coming back for a Q&A. I will ask my team to introduce Meredith to the screen so that we can kind of contextualize all that we've been talking about. And Meredith, whenever I do these things, I try to give the background that last year I was diagnosed with an autoimmune disease, and for the first time in my life, I became a patient. And that flipped everything that I do on its head. I always started with the provider first and ended with the patient. And now it's kind of like I say, why do we do it that way? So for the innovation part of what COVID-19 has brought in my own personal experience, I think that also for the format of these, what I like to do is let everybody else frame what they talk about and then finish with someone like you who ties it all together. But it's the part that I look the most forward to because it takes everything that we've kind of been talking about in concept and makes it very real. So I thank you for being here with us, and I thank you ahead of time for your courage in sharing your story and sharing how, you know, advocacy, the medical community, and your treatments have affected you. Maybe we can start with your diagnosis and a little bit of your own journey.
Sure, yeah. So I was diagnosed with acute myelogenous leukemia back in 2001. I was 19, I was in college, I was in art school, I was having a great time. It was, you know, fun. And then I got flu-like symptoms and I went to the doctor, and then I ended up having leukemia. So I came back home, and then I received chemotherapy. It didn't really do the trick. I didn't get any radiation or anything like that, just the chemotherapy. And so once that stopped working, then I was transferred. I live in Cleveland, so I was, excuse me, so I was able to go to the Cleveland Clinic, and they tested my family to see if anyone was a match for a bone marrow transplant, and my sister turned out to be a perfect match. So on September 12th of 2001, I had my bone marrow transplant, which was its own kind of strange experience, having a transplant the day after 9/11. Wow. So that was its own kind of thing. But the transplant worked well. I was fine. I was able to go home. And then in the spring of 2002, I developed graft versus host disease. And since then, I've had various manifestations of GVHD over the last 18 or so years. I was in a conference in February, and I made a joke that I think my spleen is the only thing that's really untouched by it at this point. So, you know, so it's been interesting, you know, and especially with GVHD, it fluctuates, and you get flares, and especially, you know, Sarah, like as you were talking about an autoimmune disorder, you know, there are so many different things that can affect it, and so stress can cause a flare, environmental things, food, it doesn't matter. So it's been quite a journey, and it's interesting because in February, after this conference that I was attending, by that point, I had been doing pretty well, and I was about to get off of prednisone, which I'd been on for the last 18 years, and I was thrilled. And then following that conference, then I had a flare. So now I'm back up on higher doses of prednisone. And you were talking about clinical trials earlier. I'm currently on a clinical trial for ruxolitinib, or Jakafi. So we'll see if that works. Hopefully something happens to help with that. But one of the things that happened along the way is that around 2005, 2006, I had a particularly difficult time that the doctors had a hard time figuring out what was going on. And it ended up that I had polymyositis as a result of graft versus host disease. And that's a more rare manifestation from what I understand. And so it was difficult to make the connection, and they didn't know quite what to do. And so my family, being my family, got very frustrated and also very invested in figuring out what needed to happen, what we as a family needed to do, what I as a patient needed to do. And so my dad was talking to this guy who he worked with at the time, and they decided to start a foundation. So in 2007, they started the Meredith Crowden Foundation, which again, I also joke, I don't appreciate the name. The name is great. It's lovely. I love my name. I just don't like the foundation named after me, because people with foundations named after them are usually dead. So, you know, I was like, really, do you want to do that to me?
Tribute, living tribute.
Right. Thank you. Yes, exactly. So, so they started the foundation, and basically it's very specific. It's focused on GVHD and then the late effects after a stem cell transplant. And so about every year and a half, 2 years thereabout, we have a symposium that actually is similar to this setup, which is one of the things that I really, really love about this, is that it connects patients, advocacy, and clinicians, and it brings everybody together, which I find incredibly valuable for all sides of what's going on in the treatment and the process of a cure and recovery and all of that kind of stuff. And so so we put this symposium on. This year's a bit where I think it's in October and it's going to be virtual. So it's going to be a little bit different than our typical format that we've had in the past. And I think one of the things that I think is really great, and actually I've been, like, as everyone has been talking, I've been taking notes, and there are specific themes that I have found, which is connection, acknowledgement, and collaboration. And I think that from my own experience in terms, especially right now with COVID and having a suppressed immune system is particularly tricky. And those things are so important to have the connections, whether it's with your care team, your support system, your family, whomever it may happen, just a support group online, it doesn't matter, having that connection, and then having the acknowledgement and the recognition that this is such a difficult time. And then the collaboration. And I have to say, just in listening to everybody who's talked, I think it's so impressive and such a wonderful thing that so quickly following the onset of this pandemic, everyone has really truly rallied, and everybody has taken great steps and made big changes so fast to adapt to it and to help, everyone, whoever they happen to be, get through this and get to the other side, whatever that may happen to look like in the future. So I think I want to say that I'm impressed with everybody on here. So
me too. I feel the same way that you feel. I'm impressed with you. And your living, loving tribute of the foundation, and then what it means to kind of continue to connect for patients that are affected, all the different stakeholders that can actually move things forward and make change. It's one thing being a person that goes through something, and it's another thing being a person that goes through something for something. And I think, there are so many of us that allow things to happen almost to us, and then there's those of us that say, okay, well, that happened to us, but now what's supposed to happen through us? Mm-hmm. And I love your story. I love your family. I would be jumping on their bandwagon to call it the Meredith Crowden Foundation as well, because it's got to be powered by a person with passion, and that's what I feel from you and from your journey from being so young, and then kind of living a life that lives up to that mission that you've had all along the way. So I do thank you for sharing your story. Stay right where you are. I'm going to ask my team to bring everybody back on so that we can start to round out this virtual town hall with some of the Q&A that we've been getting on all of our channels. And I think what I'll do is start with some of the questions that have already been answered. Many times people think I'm crazy for bringing these up, but you have to know that everyone on this chat can see these Q&As, but on Twitter and Facebook and the other channels, they can't. So I always bring these back up. So for everybody who's asking, how do you get in touch with these organizations? How do you volunteer? How do you get schedules of programs? For the Imerman team, people love that you're doing this and putting all this stuff together. So there's people asking, how do we get in touch? How do we get in touch? We will be posting the same ways that we got you all to be here, so we know how to reach you. We'll be posting all of that information. That will include phone numbers, websites, people, and then you guys will take it from, how do you volunteer, etc. Okay, so here, we've got a couple of vaccine questions. One question is, as a patient with leukemia, is the only time I'll be able to get back to living outside my home be when we have a vaccine? I want to raise my hand and say for all the autoimmune patients, that's a question we're asking too. Is the only time people with suppressed immune systems going to be able to get back to any kind of life after we have a vaccine? Dr. Mauro, I'm just going to ask you to answer that as you were the one who answered it in the chat.
Oh, sure. Well, I think that we're all keen for vaccine development, and we know that that's really historically the way around. An infection like this, either a significant number of people are exposed and become immune, or a vaccine is developed. I think we all have to face reality that we don't know if or when that's going to happen. So we have to potentially face the reality of living around or with a virus like COVID-19. And I think we've gotten a lot smarter about it. It was sort of pan-fear during the pandemic, because we thought the more we learned, it just sounded worse and worse. It was sort of a situation when every person we encounter, everything we touch, everything we do is going to bring the virus forward. And I think we've gotten a little smarter about that now. So I think for leukemia patients, autoimmune patients, for patients in general, the more we learn and the more time passes, A, the situation is getting better. B, we'll know what is very much a threat with regards to acquisition of the virus, what may be a lower risk. And I think activities and interactions and things that need to be done or wish to be done will begin to happen. So I think people will have a life before a vaccine. I'm hoping we have a better life and a normal life after vaccine or over time. But I want to encourage people to think that in the next, few months ahead, we're going to continue to learn more and more about how to operate safely. We already are. We're sort of doing it sort of blindly. We're sort of doing a lot of things. We're not really sure how they're working, and we're getting pretty clear signals about how they are working. And some of those things are not that hard to do.
Wonderful. Well, that's very encouraging news for those of us who are, trying to read between the lines of what we're hearing from media talk about, when things could get back to normal. So I'm grateful that you've given us, a direct application to those of us with compromised immune systems. Meredith, we are just getting such an overwhelming response to your story. And, one person asked, is it difficult to balance the things that you want to do with still living with some of the effects that you've had to go through from your treatment?
Yeah, absolutely. So it's been interesting. So I one of the things that I think is kind of going back to what I was saying earlier is that connection piece. And I have an incredible support system. I have such wonderful people around me. And so one of the things that friends of mine have been doing is that they've made a point to just for all of us to get together so that I can still participate with them as we have like a virtual game night. I don't know if you're familiar with like Jackbox or what's the other one, House Party, like those kinds of things. And so we've gotten together and we've played games. And then I've had some friends also get together with me, and they sit on the opposite end of my yard and I sit over here, and we eat on opposite ends and talk and stuff like that. And then I had a friend joke that she was going to make me remember that movie that Jake Gyllenhaal was in where he was in a bubble? One of my friends was like, we're going to make you a bubble. And then you can bounce around and, go all over the place. But I think it's been very tricky, and it's been really difficult to not feel overwhelmed by anxiety and a sense of isolation, because I think, like I said, I'm in Cleveland. And so there are things that are starting to open up around the area that I live in, but I can't necessarily engage in all of those things, specifically. There are other things that I can do. And I think so making sure that I'm doing the things that I can and engaging with the people that I can. And also the other thing that I've found that I think applies across the board is I've created a very structured routine for myself, because I have to do that, as far as making sure with like exercising and stretching and those kinds of things, and the meals and then work and stuff like that. It's, it's maintaining that and maintaining that bit of sense of normalcy, I think really makes a huge difference too.
Yeah, and that's good. I mean, that's so good for your mental health and your physical health, because it kind of keeps your body going in the direction that it should be going. Dr. Vidge, I'm going to ask you, I have a person saying that they're on active treatment and that they're worried about, you know, after the summer, if the kids are called back to school, should they be making different plans of allowing their kids to go back to school than someone who might not be compromised having been in treatment? Oh, you're on mute. Doc, if you could unmute yourself. Common Zoom.
Okay, sorry about that. Okay, yeah, sorry. So I think that, again, that's a question that is going to come up increasingly as we start opening up various parts of our society. And honestly, I'm going to have to rely on guidance from our infectious disease doctors to try to answer that question. I think that it would be wrong on my part to give an answer on this forum and then claim that it is based on evidence. So I think that I am going to have to defer that kind of question to experts to answer as these situations arise. As we have been relying on them over the last few months, things have been evolving, and some of the answers that we have been giving have also been evolving over this period of time.
I appreciate that answer so much for a lot of reasons. One, I think it really points to forums like this where you get, you know, credible advocacy organizations matched with, you know, credible medical experts matched with credible pharmaceutical organizations that don't overreach and that certainly honor that all experiences. I mean, that answer, you know, applied to a patient in New York City is very different than that answer applied to a patient in Wisconsin. So I think too that this really gives power to the fact that, you know, the answer has to be rooted in the credible sources that your physicians are using in order to help guide that. So I hope for the person who asked the question, you didn't feel that we were dodging it in any way. What we really want to do is make sure that we give you, you know, evidence-based guidance as to the ways that you plan forward. My last question in this session, I always feel like time goes by so fast. Really, it comes from a person who's asking, and I'm going to ask the Leukemia Lymphoma Society and Meredith this question just because I feel that it, you know, is most applicable almost from this call center perspective. If you're, you know, this person's living in a place where it's very difficult to access other people. And so, you know, their question stems around whether or not it would be appropriate just to call the Leukemia Lymphoma Society Center just to talk through some of the things that are on their mind. So this is a patient with leukemia, but they felt that if they used the phone line just to kind of get some questions answered, they might be taking time away from someone who needed a little bit more information. So if you could just talk to that and say, you know, what are you there for? That would be, I think, very helpful for this this listener.
Sure, and we would certainly welcome you to call us. Our information specialists are there to help everyone. And your questions are just as important as anyone else's questions. And we really want you to be able to connect and get the help and the information and resources that you need. When you call into us, one of our great information specialists will be happy to help. And then there are a number of ways that we can connect you with others. We do have our Patty Robinson First Connection programs. We can set up a telephone matching program with you. We have a great online chat. We actually just brought out our Feel Good Friday series, which is open to all blood cancer patients and gives people the opportunity to connect and talk about a variety of things, from treatment to the concerns about COVID, just from the feelings of even isolation. You know, those are really important. And you know, I know Dr. Mauro talks about being the whole person, and there was a question about stress and anxiety, and we're there to help address all of those questions, all of those concerns. So we would certainly welcome, and please don't feel that you're taking away from everyone else. We're there, we want to help you, so please reach out to us.
It's just so, I think that again, it just highlights, you know, the spirit of people at this time, that everyone wants to make sure that nobody takes too much, you know? So I appreciate too that, Meredith, that you answered that question by saying, yes, call.
Please, we welcome it. Yep.
Okay, so I always try to end these on a light note. This year, for the ASCO, we had this big educational meeting last weekend. It pulled together 40,000 providers, not just providers, advocates, nurses, everybody in the oncology community. This is our house party. We all get together to learn, to listen, to network. And this year, of course, was very different because we all had to do it virtually. But one thing, you know, I spent a lot of time on Twitter over the weekend, just taking in what other people were saying about various things. Guys, my lighthearted question is, I started seeing so many doctors take on TikTok for dancing, and they were doing all of their yoga poses. And I mean, I was seeing doctors in poses and positions I would never dream of seeing them in normal life. So I'm going to close by asking, what do you feel, and this is a lightning round, what do you feel about expressing your true authentic selves on social media? And would you engage in TikTok, yoga, meditation, relaxation, all these things that are being offered in the public eye now that we've moved over into a post-COVID world? Meredith, I'm going to start with you.
Sure. So I mean, I think it's great, and seeing all that, I think it really brings a human personality and shows how we all are coping with this. I know that we talk a lot about the blood cancer patients and their loved ones going through this, but the doctors are going through this too, and so are the support staff that are there treating the patients with us. So it's great to see it, and I think it really gives a human touch to the patient perspective.
Wonderful. Dr. Vidge, are we going to be seeing you doing your TikTok dances anytime soon? Oh, we got you on mute. I gotta.
Okay, back. That tells you that you know, I'm not one who's taken much to social media so far, but hopefully in the times to come that will happen.
Yes, I'm going to be looking out for when you join, and looking out for seeing you do all of the dance moves. So looking forward to that. Peggy, what about you? What's your take on the social media TikToks, and would you be participating?
Oh, absolutely. I'm just going to have to get all the kids in my neighborhood to show me how to do it, including my own kids. So yeah, bring it on. Absolutely.
Awesome. Awesome. Jackie, what about you?
Yeah, it's funny that you bring that up, because one of our board members had said we need to get on TikTok, and I was like, I don't know how to dance, you know, and so I was like, that's not going to be me. And she's like, no, there's so much going on. And I was like, okay, so yes, we are definitely engaging in that now. And
okay, so the Imerman team is soon to be on TikTok. We'll make sure that we look out for it. Meredith, what about you? Oh, you're on mute too.
I got it. Okay. Yeah, absolutely. I don't know. I think it'll be funny because I'm very clumsy and I'm not coordinated. So there'll be some falling over that'll happen, but I'll do it.
Girl, I'll tell you, some of these docs that I was looking at, they weren't caring about coordination. They were just caring about busting those moves in front of all of their friends and colleagues. Roxanne, are we going to be seeing you make the moves on TikTok anytime soon?
Absolutely. It's funny you say that. I've been, you know, homeschooling with my kids. I've got 2 boys, and we've been practicing, you know, the dad dance TikTok. And they would be mortified if I did that on social media. So I've got to do it now. You've made my day.
Oh, I love it. I love it. And Dr. Mauro, how about you?
I just reunited with my family recently, and my tech guru would be my 15-year-old daughter, who so far all we've done is document the incredible growth of my hair over 3 months without a haircut. Why not? You know, what a better way to counter, you know, this image with something completely different.
Yes.
The funny thing for me is 3 months, every clinic I have, someone complains and they say, where is your bow tie? Because I'm known for wearing bow ties. And my hospital doesn't want anyone to wear ties because of the infection risk. They sort of put a ban on it, and they haven't said that we can wear them again. So this is actually the first time I've worn one in a couple of months. But now for something completely different, why don't we do some TikTok dancing?
Yes, yes. You know, I do think that what this does is it lets you see the human side of all of us. We're all craving that, you know, the smile, the laugh, that organic movement of all of ourselves when we really have, you know, the belly laugh. And I have loved to see these doctors, I mean, these pinned up doctors that stand on podium and change the world. And then you see them getting down on their TikToks with their families and with their friends. It has been incredible. So that's my challenge to all of you. Get moving and get moving in front of a camera and use that as part of your platform to reach people, to say, the world is changing, I am changing, we're all changing together. We've got to take ourselves less seriously, because really the key to us getting through all of this is being kind and being loving and laughing as much as we can to battle some of the serious things that are going on in our world. So I thank all of you for being with us today. We looked forward to this heme virtual hall. Again, it was one of the tumor types that I have traditionally stayed away from in my own professional career, but I've loved it. And look out for me reaching into your inboxes going forward to help me learn and help me grow and help me spread the message to patients with blood diseases all over. So I thank you for spending your time with us, and I look forward to a time we can see each other in person. Have a great afternoon.
Thanks so much.
Thank you.
Thank you.